Welcome to the ArtiQ PFT introduction video. We will provide you with an understanding of what ArtiQ PFT is and show you how ArtiQ PFT is integrated into SentrySuite. Part 1. What is ArtiQ PFT? Pulmonary function tests are the main tools that doctors have to evaluate the respiratory systems and thus to diagnose and follow up lung diseases. The main problem with pulmonary function tests today is the interpretation. A typical PFT report contains a large number of parameters that are measured and calculated. To come to a complete and accurate interpretation, a pulmonologist needs to consider all of these numbers and the shape of the different curves generated. Therefore, it is clear to see that interpreting pulmonary function tests requires time and must be done by an expert. Although, even interpretations between experts can vary and are often not specific enough to reach a diagnosis. For the patient, this means it can take a long time until a diagnosis is reached, involving redundant additional tests. Some patients might even get misdiagnosed and given the wrong treatment before achieving their final diagnosis. To identify how big these problems are, ArtiQ did a study in 16 hospitals across 5 different countries, and they provided 50 patient cases to a total of 120 pulmonologists. It took on average 150 minutes to do the interpretation of these 50 cases, and the protocol matched the international guidelines in 74% of the cases. The correct diagnosis of the patient was identified accurately in 45% of the cases. A kappa score of 0.35 shows a large variation between the different experts. For the cases where the pulmonologist indicated that they were confident in their reply, the diagnostic accuracy went up to 52%. These numbers show that there is significant room to further improve the interpretation of pulmonary function tests. That is why ArtiQ PFT was developed. ArtiQ PFT is an artificial intelligence-based software that automatically processes PFT data and generates a comprehensive report for the pulmonologist. The first part of the report provides a protocol according to the international guidelines to save time and improve consistency within the department. The second part of the report is where the core intelligence of the software is used. With artificial intelligence, the probabilities for several diseases are calculated based on the specific lung function of that patient. In the last part of the report, a conclusion and further suggestions are provided. The software is CE marked and over 70,000 interpretations have been performed in Belgian hospitals. The software currently supports the following languages: English, Dutch, French, German, and Italian. To assess what impact ArtiQ PFT can have, the software has been used to provide the interpretations for the same cases from the study mentioned before. The software provided the interpretations fully automatic and almost immediately, and all protocols were in line with the international guidelines. The most remarkable results are related to the capability of the software to predict the final diagnosis. The software has a 82% accuracy, almost double the result of the average individual pulmonologist in the study. When the calculated probability is high, this accuracy even goes up to 98%. These results show that there is a great potential for ArtiQ PFT to support pulmonologists in the interpretation of pulmonary function tests and add value to the diagnostic process. The ArtiQ PFT software also performs very well across different disease groups. For the 2 most common lung conditions, COPD and asthma, the software has a great sensitivity without having a decline in positive predictive value. Determining whether a patient has a rare disease, specifically interstitial lung disease, is a significant issue today. This is an instance where timely diagnosis is critical. The ArtiQ PFT software performs very well in terms of identifying this disease, therefore emphasizing the high sensitivity of the software. To summarize, why would you want to start using ArtiQ PFT at your center? First of all, you want to spend your time as a specialist where you are most valuable, in clinical decision-making and patient consultation, not on administrative tasks such as protocoling. The automated report also allows you to boost consistency within the department. Each protocol contains the same level of detail and is in keeping with the international guidelines. With the support of artificial intelligence, you can boost your diagnostic accuracy early on in the diagnostic process. And finally, the software provides you with suggestions for the next steps to confirm or strengthen your initial diagnosis. Part 2. ArtiQ PFT integration in SentrySuite. ArtiQ PFT is integrated in SentrySuite Review desktop application and in Mobile Review, which is our browser-based application. The feature set is the same in both. We'll show 3 different use cases integrating ArtiQ PFT in SentrySuite Review. Each of the use cases are adaptable to the physician's workflows, which saves time and cost. Use Case 1. Direct Integration in Interpretation View. This is in most cases the standard workflow for the physician. When used together with the batch report functionality, a series of visits can be interpreted by the physician within the shortest possible time. We log into SentrySuite Review application. We open the report complete_pulmonary from Visit View. Of course, this report depends on the dedicated hospital workflow. By clicking on the plus sign, the report selection window opens. When ArtiQ PFT is configured, then a category interpretation will be shown in the dialog. We see the report ArtiQ PFT on the right-hand side of our screen. This report name can be customized in the settings. We select the line and click OK. The report is generated by connecting the ArtiQ PFT cloud server. The report is generated and a success message appears. The ArtiQ report with all elements is shown. This report can be used for interpretation. We can integrate the interpretation text into our SentrySuite report by simply selecting Insert Text from Interpretation Report. The protocol and the disease probability in textual form is pasted into the Review Interpretation view. This text can be reviewed and changed when needed. The report can now be signed and sent to the HIS EMR system. Depending on system settings, the SentrySuite report and the ArtiQ PFT report are both sent to HIS. Use Case 2. Create and send to the Health Information System, starting in Visit View with direct access to Interpretation View. This is a workflow which is most commonly used when the physician prefers to interpret a single visit. The second use case starts in Visit View. By selecting New, the report can be generated from Visit View. If the checkbox Open Report is selected, the system will wait until the report is generated. At this point in time, we can review the data. Use Case 3. Create from Visit View and send directly to the Health Information System. This is a workflow which can be done by a technician or a physician. It is used when a detailed interpretation is not needed. We start with the same workflow as before. We don't select Open Report. The ArtiQ PFT interpretation is generated. Of course, it can be reviewed by clicking on it, but in our case, we send it directly to the Health Information System. We are informed that the report has been successfully sent to the Health Information System. The 3 use cases show how easy ArtiQ PFT interpretation is integrated into SentrySuite and how they can be tailored to the physician's workflows. Thank you for watching the ArtiQ PFT SentrySuite integration video.